It's been a blessing to be a part of some really large organizations and some very well-developed organizations, because to achieve 4-star, 4.5, 5-star, and Medicare stars, it takes a full organization. It takes operations, quality, clinical areas, customer service, multiple areas in order to be able to work together to really build out the star score. So a few examples of that. Our operations team keeps the lights on. We ensure claims and bills get paid in a timely manner to our partner physicians. We have a provider engagement team that goes out, helps physicians to close care gaps like cancer screenings or diabetic eye exams. So we also have one of our most key aspects of STARS, which is consumer experience. So we have a full CX team, and we do a survey called CAHPS, which is the consumer assessment for healthcare providers and systems. And it's a survey sent out to our members, supervised by the government, and ensures that members are satisfied with the care they receive care timely, people are kind to them, and they are getting what they need from their health plan. I love Hallmark greeting cards. I thought of Hallmark, and we started to engage because I received cards myself from some family, friends, and I actually received it from one of the health plans that I was a part of, and I thought it's pretty special to get one. I want other people to feel how special it was. So the important thing with members, they want to feel seen, they want to feel heard, and part of CareSource's mission is healthcare with heart. And we have an opportunity to do that and show members how we care about them by engaging them. And this partnership with Hallmark, we could really capture the joy of receiving a personalized card, envelope with a gold seal, share this with our older adult population, which a lot of them feel very lonely. Maybe their kids have moved out or they're living by themselves, and now they get a card where they have not received a card all year. And it really makes them feel special. And it's something that's coming from the heart, asking for nothing in return, and acknowledging what a blessing it is to be a part of their lives. And I feel like that we can be a blessing because the members are a blessing to us. We actually did a study after we did our Hallmark card because we wanted to see how effective is it. Are members paying attention to it? How do they feel about it? And just with what we were able to get from the survey, over 75% in both areas. And it was very special for them to get a card. And further than that, it was special to see the message that we had in there for them as well, too. So I'll share a little bit of information about the HOS survey. It stands for the Health Outcomes Survey. And what CMS asks for, it's a limited study. It's like a 3-year cohort study. So it follows the same group of patients for 3 years. And it asks them certain questions like, how is your physical health? How is your mental health? It also asks about urinary incontinence and falls. So these are very, very important pieces of information for us as a health plan, but also for the provider, because we want people out there living healthy lives. We don't want them falling. We don't want them going to the hospital. We want them to enjoy their life, right? So I love that health plans are using Hallmark for HOS as well, because what it does, it really opens them up. It really helps the patient to go, you know what? I can share a little bit of this information here. I feel comfortable because I feel like the health plan cares about me. And I think that's probably one of the biggest things for using Hallmark for HOS. I think the biggest thing is connecting with members as human beings. In this age of AI, natural language processing, being able to do things at the drop of a hat. Most things are automated now. I think it's so refreshing to go back to like, what are our roots? Getting a beautiful card in the mail, right? Um, just having somebody pick up the phone and a human being telling you, acknowledging your name, telling you you're special, telling you that they hear you and hear what you're going through. I think that would be the biggest key to success for any health plan going forward, because what is going to differentiate one health plan from another? It's trust. It's going to be trust. It's going to be connection, because once members can feel connected to the health plan, I think that just the possibilities are endless in terms of what we could do for a joint partnership in healthcare. What I love about Hallmark is when a health plan sends a communication to a member, we have to put a lot of writing on it, like health plan documentation enclosed, with a lot of small writing in the background. And when a member expects a health plan communication, unfortunately, most of the time it is not good. Maybe it's a bill, maybe it's a big notice of something. But to be able to get a Hallmark card, I think is absolutely refreshing to a member, to get a communication from the health plan that is not bill or, what's it called, benefit related. Probably the biggest thing, and I'll take this as a leadership tenet, right? It's trust and empowerment. We have to be able to, one, hire people that are smarter than us. Everyone I hire is smarter than me, and I'm proud to admit that any and every day. And then two, I have to trust them. I hired them because I believe they're going to bring some strong innovation to our organization, and then I got to trust them. And then finally, how can I back them up? As a leader, how can I remove roadblocks that are in front of them and empower them to get some of their vision moving along? So I think innovation is very important, but it has to come with, one, bringing in the right people, and then trusting them and empowering them. Once we have that, we have great programs like Hallmark, being able to be implemented for our members that not only improve outcomes, but just overall, I can look back at this and look at the mirror every day and feel like I've done something really nice for another human being and many other human beings. So that's why I go to work, being able to have that feeling and to know that we've done something special for somebody else.